So this is a coccyx procedure, a little bit invasive. You've got to explain to the person that you're going to be doing a gentle move over the coccyx. You don't have to do it on the skin because all you're doing is moving the skin. The first is an assessment. Sometimes you do a coccyx procedure because it energizes all the nerves going up the spine, and sometimes you can do it because there's a specific pain. So if there's a pain in the coccyx area, if somebody comes in and says they've got a pain there, you need to assess which side it is. So to assess it, you can find the coccyx bone, which is just at the bottom of the sacrum. It's like a little tailbone that curls around, and this has to move, of course, in childbirth and things. So sometimes in an injury, if you have a fall, you can break it, or you can it sets to the wrong place. So sometimes one side is more painful than the other. So this is a test you do for that. Put your finger over top of the coccyx bone. You can do it through closed, it makes no difference at all. And then go to the edge and ask the person, is this the most painful side or this the most painful side? And then you'll know from their answer then whether to stand on the left or the right side to do the treatment. So we'll say the answer is the left side is the most painful. That means you're going to be doing the move. What you're doing is doing the move from the painful side across the midline. Okay, so if this is the most painful side, closest to me now, I'd find the bottom of the sacrum, and my finger is going on the bottom edge of that sacrum. My index finger is going to the side of the coccyx bone. I'm lifting the leg because this is one of the other ones where we do the leg lock. So actually I'll have to get you to move your head to look at the wall. Yeah, perfect. So then we do the leg lock until it just starts to lift the hips, and then we ask a client to take a breath in and then just leave a breath out, let it go. And this is a little skin move just going over the coccyx and then lifting straight up and setting the leg back down. So we only do this on one side, so you just got to pick the painful side, or as a default do it the way that I've done it here as a default, with the head and the leg the same direction, but the direction of your move is away from you, going from the painful side to the less painful side. And then the next part of a coccyx is in two parts, so we then turn over. So get rid of a bolster. If we turn the client over, and I'll put a pillow there. So now this time the side he was working on, because he's turned over, is this side. So this is the side you want to work, and this is a little bit similar to the pelvic procedure where you're going to be lifting the leg up to the shoulder a little bit. So if we have your hand down there, so we've got to find a position midway between the navel and halfway along the inguinal ligament. So you've got a point there to there is where you're measuring, and the move is going to be midway between those 2 points. So I'm gonna have to stand this way to show you. So the move is going to be with my middle finger, and I'm finding that point halfway between the navel and the inguinal ligament, flattening my finger. The skin slack is going towards the leg, and then I'm taking the weight of the leg, and as I'm slowly moving it towards the shoulder, I'm doing a move towards the navel and then out laterally as the leg moves on. And you don't have to push it as far as the pelvic, it's just a little move. Gently straighten the leg out and let the leg go back in. Okay, so this was middle finger. Once you find that point halfway between the inguinal ligament and the navel, you take the skin slack down towards the leg, press in, move as far as the skin will let you go towards the navel and then come out like a figure 7. So the second part of the move is actually going that way. Okay. So if you picked the other side coccyx to do, because the other side was more painful, then you would then do it with this leg then. So you would have this leg up and you'd find a corresponding point halfway between, and you go skin slack down and do a move up and then out. So it's like you're drawing a figure 7. That would be a backward 7 on this side. Okay, thank you.